Hi everyone. I want to start by saying I was pretty nervous when I realized the amount of reading that we had to do for this week. When I realized we had to read an entire book in one day, I was like, wow, I didn't even read one book for the whole of last year and I have to read a book in one day. Anyway, putting all jokes aside, it was an enjoyable read. And as Suzanne said, the book was an easy read because of the photos and the illustrations and the poetry and that was incorporated. However, all of that didn't diminish from the content of the material. It does the opposite for me. In fact, it illuminates it. So Reassure tells the narrative of a community rallying together to promote social justice in one of Canada's poorest, in terms of finances, financially poorest neighborhoods. It's very rich in other ways as is displayed in the book. So we're talking about downtown east side in Vancouver. And the three things that I found most intriguing about the book was one, the fact that it told the seldom heard narrative of the drug users from the point of view of the drug users themselves, and that they themselves were the heroes of this book. Number two, the newspaper articles and the reports were not as biased and ignorant as many of the other mainstream articles are. And three, the use of poetry, photographs, and meeting records were effectively employed to illustrate how community mobilization was powerful enough to create North America's first supervised injection facility called Insight. And to me, that's a remarkable feat. I will go on to expand on these 3 points a little later. So in the first chapter of the book, we are told of the complexity of the situation with downtown East Side, where we have poverty, racism, and violence intersecting to provide a backdrop for drug use. As we learned earlier on in this course, marginalized sections of the population are more likely to seek relief in the use of criminalized drugs, so this backdrop wasn't surprising at all. We learned that by the late 1990s, Vancouver had one of the worst criminalized drug problems in the world. And Nothing About Us Without Us, we learned that in 1996, it was estimated that about 47% of new HIV infections were among people who injected illegal drugs. That's on page 2. They went on to say that the rates have decreased, but it is still at an unacceptable level. So we had a situation where the rate of HIV infection was increasing at an alarming rate. Drug overdose deaths were increasing, and hundreds of our brothers and sisters were dying. It got so bad that the local health board in Vancouver declared a public health emergency. The authors of Race Shift include sections of an independent evaluator's report on this emergency to illustrate how the government's response to the situation, or lack of response, was embarrassingly inadequate. They included newspaper articles to demonstrate that this response reflected a politicized environment where most medical practitioners, politicians, law enforcement officials, and policymakers were unwilling, not unable to, but unwilling to recognize the benefits of harm reduction strategies. So in this book, we are told about drug users' frustration with the lack of response from our so-called leaders, which provided the impetus for their advocacy campaigns to promote harm reduction and have more of a say in their own lives. This resistance was an example of marginalized persons demonstrating their strength and capacity to determine what choices were the best ones for them. By forming Bandu, they were able to mobilize and provide support to some of our country's most marginalized sectors. When I read chapter 5 in Ration, I was captivated with the simple yet haunting nature of the Bandu meeting record. I was captivated because we were presented with an enormous amount of invaluable insider knowledge, of user perspectives on the government's policies for criminalized drugs, their perspective on the lack of adequate treatment and services for addiction, and their opinion of law enforcement and social services. These are all issues beaten to death in the mainstream media, but it is rarely depicted from an insider perspective. So that was very refreshing to me to see that kind of information. So far from the usual media depictions of drug users as lying, sadistic, cold, uncaring subhumans, this book illustrates their willingness to support and care for other drug users. It also illustrates their concern for other marginalized groups in the community. Example, racialized groups. And I quote, Latinos are in our community. How can we live with each other? The access. We see that in the meeting records on page 46. They also have a yearning for adequate housing, a need for safety, respect for their neighbors and for their neighborhoods. And I quote, keep the parks cleaner. Get syringes disposed of safely. We need a sharp container here on page 46. So when I do my reading, I like to note what I call my aha moments. So this week it happened to me twice. At the start of chapter 4 in Reshit, we are presented with a 1997 article from The Province, a newspaper called The Province. And one of the questions that the author poses is, how many human deaths does it take to meet the same attention as one whale? Apparently a lot. This was in reference to the public protest when a killer whale died at the Vancouver Aquarium, in contrast to the public lethargy and even vilification of hundreds of drug users dying in their own backyard. The aha in this story is that not much has changed almost 20 years later. My second aha moment came when I read the Vandu meeting records of November 15, 1997. Some of the participants expressed the views that the funders were not providing for their basic needs like detox, treatments, showers, etc. That's on page 51. And I quote, money instead goes to the service providing agencies who hire people with university degrees who get $30,000 to $40,000. They set you down and tell you, you have a drug problem. And then they have nowhere to send you. And they have nowhere to send you, nowhere for detox, or a place to live that won't kill you. Service provided agencies and their staff lack the political will to change things. They are not for us. Wow. What an eye-opener for me. Like, this hit home. When she talks about, or he or she or they talk about, these agencies hiring people with university degrees and paying them big money, they're talking about you and I. I work at a women's shelter, and I totally agree with what these service users said. We get money for staffing, for programming, for a lot of stuff, but we do not have all the crucial services that our clients require, or can we refer them to anywhere that could provide them with all of these services. So I'm talking about detox, trauma counseling, an apartment, a car to get around in a rural community. We have nowhere to refer our clients to. For example, in our town, we have a waiting list of about 3 months to see a mental health counselor. There are other counselors that charge $180 an hour, $200 an hour. Our clients can't afford that, so they have to wait for a free service. So what happens in the interim? A lot could happen in 3 months. In our community, we have a taxi service that's ridiculously expensive. There's a bus service that's fairly reasonable, but it's staggered and sparse, and it doesn't cover the whole community. So imagine me looking at a mom and saying, you should try to find a job. What is she supposed to respond to me? She has no car, she has no fuel, she has no means to get to her job and back, or is she even expected to get to the interview? So if the government is not providing for some of the basic services that our clients need to move on successfully, it is totally understandable that drug users will feel a strong sense of disappointment and distress in us. So circling back to the original question on how the representation of people who use criminalized drugs differ in Reshit from mainstream text and visual depictions, it is glaring. In mainstream media, we are presented with very biased messages which tell us that drugs and drug use are harmful or morally wrong, which in turn reinforces current political ideology. They use messages which are laden with myths, stereotypes, propaganda, and false information. Anything and anyone associated with criminalized drug use is condemned and portrayed as dangerous. The ill effects of drug use is highlighted with no scientific evidence to support the claims being made, and the focus is on scare tactics rather than a more realistic approach, which is how do we keep people safe if they decide to use drugs? I believe that the depictions made in films are particularly damaging because drug use is always linked to prostitutes, crimes, violence, gangs, etc. If one compares one set of representations with the other, we can only come to the conclusion that they are completely juxtaposed. Have a good week, everyone. Thank you.